Isometric exercise, a type of strength training where muscles contract without changing length and without visible movement at the joints, has been shown to have significant benefits for lowering blood pressure. This form of exercise is particularly appealing because it requires minimal equipment and can be done almost anywhere, making it accessible for many individuals, including those with limited mobility or those new to exercise. The connection between isometric exercise and lowered blood pressure has been studied extensively, and several mechanisms contribute to its effectiveness. Below is a detailed exploration of how isometric exercise can help reduce blood pressure, supported by scientific explanations. Please do remember to like and subscribe to our channel. What are isometric exercises? Isometric exercises involve contracting a muscle or group of muscles against a fixed resistance without any noticeable movement. For example, wall sits, where you sit against a wall with your knees bent at a 90-degree angle but without actually moving. Planks, where you hold a static position on your forearms and toes, engaging the core. Isometric hand grip exercises, squeezing a hand grip device or making a fist for a set period without moving your hands or arms. Isometric exercises are different from dynamic exercises, like weightlifting or running, where joints and muscles go through a range of motion. Instead, the focus in isometric training is on holding a static contraction, which, over time, has been linked to improved cardiovascular health and reductions in blood pressure. How isometric exercise lowers blood pressure. Several physiological mechanisms explain how isometric exercises lead to reduced blood pressure levels. Let's break them down in detail. Vasodilation and improved vascular function. When you perform an isometric exercise, the muscles contract and temporarily reduce the blood flow to the area being worked. This action increases the demand for oxygen and nutrients in the muscle. In response, the body signals for the blood vessels to dilate, widen, to increase blood flow to the muscles once the exercise is completed. This process, called vasodilation, helps to reduce the resistance that blood faces as it flows through the arteries, which directly leads to a lowering of systolic and diastolic blood pressure. How it works: during the isometric contraction, blood flow is restricted due to muscle tension. Once the contraction is released, the blood vessels dilate, improving overall vascular function and promoting healthy blood flow. This widening of the blood vessels reduces the pressure against the arterial walls. Long-term effect: regular engagement in isometric exercises enhances the endotheliums, the inner lining of blood vessels, ability to dilate, which leads to a long-term reduction in blood pressure. 2. Decreased sympathetic nervous system activity. The sympathetic nervous system, SNS, is responsible for the fight or flight response, which includes increasing heart rate and constricting blood vessels, both of which can elevate blood pressure. Overactivity of the SNS is a common contributor to high blood pressure, hypertension. Isometric exercises have been shown to decrease the activity of the sympathetic nervous system over time. This leads to lower heart rate and reduced vasoconstriction, narrowing of the blood vessels, contributing to lower blood pressure. How it works: when you hold an isometric contraction, especially in hand grip exercises, it triggers a slight increase in SNS activity to maintain the contraction. However, when done regularly, the body adapts by reducing overall SNS activity, creating a more relaxed state for the cardiovascular system. Long-term effect: with reduced SNS activity, the body maintains a lower baseline heart rate and reduced tension in the blood vessels, which results in consistently lower blood pressure levels. 3. Improved baroreflex sensitivity. The baroreflex is a critical mechanism in the body that helps regulate blood pressure. It involves sensors in the blood vessels, called baroreceptors, that detect changes in blood pressure and send signals to the brain to either increase or decrease heart rate and blood vessel tension to maintain stable blood pressure. In people with hypertension, baroreflex sensitivity is often impaired, meaning the body doesn't respond as well to changes in blood pressure. Isometric exercises can improve the sensitivity of the baroreflex, allowing the body to regulate blood pressure more effectively. How it works: the sustained muscle contractions during isometric exercises cause a temporary increase in blood pressure, which activates the baroreceptors. Over time, regular exposure to this stress improves the receptors' ability to detect changes in blood pressure and respond appropriately by lowering blood pressure when necessary. Long-term effect: with improved baroreflex sensitivity, the body becomes better equipped to regulate and stabilize blood pressure, leading to lower levels overall, particularly during times of rest or minimal activity. 4. Reduction in arterial stiffness. Arterial stiffness, or the rigidity of the arteries, is a significant risk factor for hypertension and cardiovascular disease. Stiff arteries make it harder for blood to flow through the circulatory system, increasing the workload on the heart and raising blood pressure. Isometric exercises have been shown to reduce arterial stiffness, improving overall cardiovascular health. How it works: regular isometric exercises lead to structural changes in the arterial walls, making them more elastic. This elasticity allows the arteries to expand and contract more easily, reducing resistance to blood flow and decreasing blood pressure. Long-term effect: by reducing arterial stiffness, the heart does not need to pump as forcefully to circulate blood, which lowers the pressure on arterial walls and decreases overall blood pressure. 5. Increased nitric oxide production. Nitric oxide, NO, is a molecule produced by the endothelium that plays a vital role in maintaining vascular health. It helps to relax and dilate blood vessels, which improves blood flow and reduces blood pressure. Isometric exercise has been found to stimulate nitric oxide production, enhancing its beneficial effects on the cardiovascular system. How it works: the increased blood flow demands created by isometric exercise stimulate the endothelium to produce more nitric oxide. This, in turn, promotes vasodilation and helps keep the blood vessels healthy and flexible, reducing blood pressure. Long-term effect: over time, regular isometric exercise increases the bioavailability of nitric oxide in the body, contributing to sustained reductions in blood pressure. 6. Improved resting blood pressure. One of the most significant benefits of regular isometric exercise is its ability to lower resting blood pressure, which is the pressure in the arteries when the heart is at rest between beats. Numerous studies have shown that people who incorporate isometric exercises into their routine experience significant reductions in both systolic and diastolic blood pressure. How it works: after performing isometric exercises over time, the cumulative effects of improved vascular function, decreased SNS activity, and enhanced baroreflex sensitivity lead to reductions in resting blood pressure. Long-term effect: this reduction in resting blood pressure is crucial for reducing the risk of hypertension-related complications, such as heart disease, stroke, and kidney damage. Supporting evidence from research: several scientific studies have supported the idea that isometric exercises lower blood pressure. A meta-analysis published in the Journal of Hypertension found that isometric hand grip exercises led to significant reductions in blood pressure, with an average decrease of 10 mm of mercury in systolic blood pressure and 6 mm of mercury in diastolic blood pressure. Another study published in the American Journal of Hypertension showed that after 8 weeks of regular isometric exercise training, participants experienced a 12.5 mm of mercury reduction in systolic blood pressure and a 7.9 mm of mercury reduction in diastolic blood pressure. These reductions are comparable to or even greater than those achieved with some blood pressure lowering medications, making isometric exercises a powerful, drug-free option for managing blood pressure. Practical application: isometric exercise for blood pressure control. Isometric exercises can be easily incorporated into your daily routine and are especially suitable for people with busy schedules or limited access to gym equipment. Here's how you can apply it. 1. Hand grip exercises. Use a hand grip device or simply squeeze a tennis ball. Hold for 20 to 30 seconds, then relax for 30 to 60 seconds. Repeat 2 to 3 times per hand, several times a week. 2. Wall sits. Stand against a wall and lower your body until your knees are at a 90-degree angle. Hold the position for 30 to 60 seconds. Perform 2 to 3 sets, 3 to 4 times per week. 3. Planks. Get into a plank position on your forearms and toes, with your body in a straight line. Hold for 30 to 60 seconds. Repeat 2 to 3 sets, several times per week. Conclusion: isometric exercises are a simple yet highly effective way to lower blood pressure and improve cardiovascular health. By improving vascular function, reducing sympathetic nervous system activity, enhancing baroreflex sensitivity, decreasing arterial stiffness, and promoting nitric oxide production, these exercises can help reduce both systolic and diastolic blood pressure. Whether through hand grip exercises, wall sits, or planks, incorporating isometric exercises into your routine can be a powerful tool for managing hypertension and maintaining